for anybody who doesn't know what hydroxyapatite is, can you explain what this amazing biomimetic ingredient is?
Yes. And hydroxyapatite isn't that new. It's just kind of new here in the U.S. and new here with our dental organizations talking about it. But it has been around since the 1970s. And that is around the late 70s, early 80s was when countries like Japan, Italy, they jumped on it and they started adding it into their toothpaste. And so we've had clinical evidence and in vivo, in vitro studies since then about the magical powers of hydroxyapatite. So hydroxyapatite, it's calcium and phosphorus. It is what comprises up your enamel. 97% of your enamel is made of hydroxyapatite crystals, calcium and phosphorus crystals. And 70% of your dentin and bone are made of hydroxyapatite. Hydroxyapatite has been used in medicine, particularly with implant surgeries and bone graftings and things for decades and decades and decades. And a lot of the controversies that we're hearing about it, they're not in the medical community, it's the dental community. And I have suspicions about that, but we can get to that later. But if you look at the clinical data, it is comparable to fluoride, and actually more data is coming out now showing it outperforms fluoride. And I am privy to some recent research that shows it blows fluoride out of the water, especially if you're using nanohydroxyapatite. So Boca was actually one of the first companies to bring it to the U.S., so hats off to them. I think that was 2015. But again, this has been used in other countries. Apogard in Japan is the OG. It was been around since the 80s. And in Japan, that's mostly what they use in their toothpaste is hydroxyapatite. A lot of Western European countries are moving that way too, Italy, etc. I will tell you, since I started implementing it in my practice, which was probably about 2015 when Boca launched, I was lucky that I just heard about it. I have seen my patients get so much healthier than using fluoride. And I think part of it is because of that antimicrobial nature of fluoride. That's something we're not talking about, that we are damaging the diversity and the commensals in our mouth. Hydroxyapatite won't do that. And so what does it do? There's micro and nano versions. I am a fan of nano because I have found it works much better than micro, and there are studies to support that as well. But it can help with sensitivity. It helps with prevention, of course, remineralization, cavity arrest, and it can brighten and whiten too. And if you're using a nano version, it's because it will not only occlude dental tubules, but it can actually get into the dental tubule and kind of recreate the structure of the cavitation. And so I do see a lot of remineralization in my pediatric patients who are using nanohydroxyapatite. We avoid a lot of fillings at my office, a lot of sedation, a lot of anesthesia, and it's incredible. It's truly magical. I have been using it myself now for all these years. I would never go back. Your teeth feel amazing with it. So I think there is a movement. You know, a dental code was created January 1st of 2024 for a hydroxyapatite varnish. Unfortunately, a lot of insurances still aren't covering it, but I think that will change. It takes time. It was the same when silver diamine fluoride came on the scene. They were denying it. It's going to take time. It'd be really nice for the ADA to back it. They will only back fluoride. The FDA will only back fluoride, but I am hopeful in these next years with some changes at a government level that will also change, because there are other things that remineralize teeth. Theobromine is also another wonderful agent that can remineralize. I will tell you, it doesn't work as well as nanohydroxyapatite, but there are options. It's not just fluoride, you know. And so so I met Dr. Berhenna on Instagram. We obviously have a lot in common. We talk and kind of rant and rave about things. We were working with some of these toothpaste companies, either just as consultants, unpaid. I was always unpaid for my consultations. I did become an affiliate, you know, on social media for some of them because I believed in the product so much. But he and I would just discuss, these products are great, but they still have surfactants, they still have emulsifiers, they still have really strong essential oils. And so he and I are both very microbiome focused. And so that is why we created our own toothpaste brand that not only remineralize, but really our whole brand mission is about the oral microbiome. That's truly why we created it. It's oral microbiome supported. So we have prebiotics and amino acids in there to boost and modulate the microbiome, but also have this amazing, incredible remineralizing agent. And we use Nanoxam from Portugal, which is the highest quality globally. You know, it's the only version of nanohydroxyapatite that has been scrutinized and approved by the scientific community for consumer safety in the EU. Again, of course, the FDA hasn't even looked at this. So, like, people ask, is it FDA approved? Well, no. But many people don't realize fluoride isn't FDA approved for the way that we're using it. It is being used off-label as a desensitizer. It is not approved for cavity prevention or remineralization. And fluoride prescriptions are not FDA approved either, yet we're still prescribing them. So that is my counter argument to that. But the SCCS in the EU, which is a very well regarded oversight committee for ingredients in consumer goods and cosmetics, has approved it after nearly a decade of scrutiny. They approved Nanoxam, which is a proprietary blend. It is heavily regulated. It's biomimetic. I encourage everyone to head to Fluidianova's website to learn more about it. They have such integrity. They're tested. They've done testing in vitro, in vivo. Because I know this will be coming. Like, well, I heard nanohydroxyapatite crosses the blood-brain barrier, affects lungs. Okay. So we have to be very careful what we're listening to on social media and trying to see who is saying this messaging. I think some of it are people who really just don't understand the science. They look at a headline and they regurgitate it. And others have maybe some self-motives involved too, okay? I'll just leave it at that. But when you look at the studies, I've never seen a study talking about blood-brain barrier, but the cool thing with Nanoxam, it was shown to dissolve in solution in just minutes, completely into its mineral components, so it will not cross epithelial linings, which means there's no way it could get into the blood-brain barrier. And they're continuing to test this constantly, including human trials. So my argument is, with some of these natural toothpaste, what level of scrutiny does your toothpaste have that is that highly regarded? You know, I will tell you, naturally sourced hydroxyapatite that is from the soil or from bone or from shell or, you know, like eggshell, I would want COAs on that. So a lot of those, because we've polluted our environment, are very high in heavy metals. And ironically, they can be very high in fluoride, which is in the environment. So just because it's from soil or from eggshell or from bone, especially bone, holds on to heavy metals. That's where we hold on to our heavy metals. So you're using bone in your toothpaste. What is the heavy metal content? You really do want to know. So that's my answer to that. You know, Dr. Brahenna and I, we actually waited to formulate until that SCCS report came out. We would have launched years ago. We wanted the SCCS report because we didn't know what direction we were going to go in. We believed in nanohydroxyapatite. We wanted that level of science and research and human trials and safety assessment. And then the report came out, they approved it, and we said, game on. And they keep reassessing it and they keep approving, but it's only Nanoxam from Portugal. So I do caution people to not use hydroxyapatite sourcing that isn't from a manufacturing facility that has been approved. And right now, the only one that's been approved is Fluidanova. There's a lot that are being sourced, unfortunately, like out of China, and just who knows what the level. I mean, some of it is like, who knows if it's even hydroxyapatite. Again, what's the heavy metal content in that? How was it handled and stored? Are there impurities? So, but what's so interesting about this, no one asks about fluoride in their tooth. Where's the fluoride come from? You know, it's so funny that hydroxyapatite is under such a microscope. And I think that there's reasons for that. There's people pushing back on it because it's threatening to the fluoride industry, to be honest. I mean, I think some people are really worried. People are worried about it. So
it is. And at least all of the clinical studies that I've read, I really do think that it will be the replacement. At least in my hands, it's the replacement for fluoride. And there's actually a really cool backstory to how we started using it for remineralizing our teeth. I don't know if you know anything about that.
I do, but you go ahead. No, you can go. Is it NASA? Is that what you're talking about?
Yeah.
Go ahead.
From what I understand, they were starting to see that these astronauts were having demineralization in their teeth, and so they started using hydroxyapatite to help to remineralize their teeth, and that's how we started looking into it.
That is right. And then my understanding is then the Japanese caught wind of it and created the patent for it, or maybe they bought the patent from NASA. I'm not totally sure of that fact right there, but regardless, and out of that came Apogard, which is still a wonderful product, which is a Japanese toothpaste. And I have a lot of followers and even patients that they just love their Apogard. And there's so much science and data behind it. So the whole thing with this is haters are going to hate. You're going to, as a dentist, you're going to have patients coming in saying, I don't want this. I don't want to use that. I read this online. Our jobs are just to educate and then let them make their decision. But I would love all patients to be using it because they will get healthier. I really see teeth get healthier. I see oral microbiomes get healthier. I just see the tissues get healthier. So anyway, but I agree with you. I think it is going to become the gold standard here in the U.S. I do.